All right, so good morning. Thank you for taking time out of your busy schedule to join me this morning as we talk about epilepsy. This is part of my crash course series, and it's just going to be a general, very broad overview of epilepsy, what it is, how it's treated, how it's diagnosed. And for those of you caring for loved ones who have this diagnosis, some of this will be something you already know, right? It could be information you've already researched on your own, or you've had these conversations with your healthcare provider. But this is going to be a great overview for if you are to share or not share, if you were to have somebody come in and give you a respite provision. This could be something that you could show them to kind of give them a good ground, a foundation, right? A starting point. And it's also just good to kind of brush up on some information maybe you learned a while ago, but to have a reminder is never going to hurt, right? So before we get started, if you would like to participate in the post survey and give me your feedback on this presentation as well as ideas for future presentations, please put your email address in the chat box. I will send those post surveys out after the presentation today. It should be sometime in the early afternoon, and fill that out as you have time to do so. And of course, it's not necessary. You don't have to do it. It's not an obligation you have to fulfill. It is just an opportunity if you'd like to take advantage of it. I do want to say that I am a researcher. Okay, I'm a social worker. I'm a licensed social worker. My skill set is more so in the mental health field. I am not a medical professional. So this information I'm giving you today is not going to be used to treat or diagnose any illness or disease, or diagnose anybody with epilepsy. And this, of course, is not going to substitute actual medical care or advice from a medical professional. All of the information I am going to present to you today was researched by sources online. Let's see here. Okay. And so I will also leave the sources for you on my final slide. So if you want to do deeper research, or if you want to check my facts, you're more than welcome to do so. Okay. But that'll be at the very end. And also, if you have any questions as we go on, feel free to put them in the chat. We will have some time afterward to have a conversation, so we can always discuss it afterwards. And it will not be recorded, that discussion portion, but this will be recorded. It will be put online. So if you want to go back and watch it, look for that probably early Monday. And that's when we have it on our YouTube channel, on our website. And I think that's the only places we put it. Yeah. But it'll be there. So you can go back and look at it and share it with your friends and family. Okay. All right, so our agenda today, we're going to define seizures and the different types of seizures. We're going to discuss what epilepsy even is and what causes epilepsy. How do we treat it? And then we're going to go through some first aid myths on treating epilepsy, and also some protocols, some tips, so that you can feel confident in providing care for your loved one, or providing respite for that loved one if somebody were to ask you to do so. Okay. So what are seizures? So we probably have a good idea of what seizures are, especially if you're caring for somebody who has a seizure disorder. You know exactly what they are. But just for the sake of education, I'll let you know that seizures, they are sudden temporary bursts of electric activity in the brain. So it just kind of surges in the brain. It's sudden, it's not controllable, and this can really change how the brain communicates, how messages are being received in the brain. Okay. And it can also cause involuntary changes in the body, in movement, function, sensation, behavior, or awareness. Okay. And every brain has this potential to seize. Okay. But a person with epilepsy has a lower seizure threshold, and that just means they're more likely to experience seizures than people without epilepsy. Okay, but everybody has the potential to have a seizure. And not everybody who has a seizure disorder or has epilepsy, which we'll go into that a little bit more later on. There is a distinction between seizures and epilepsy. A seizure is an event and can be a symptom of other medical problems. Okay, so some seizures, you don't even notice them, and some of them are completely disabling, right? About half of the people who have one seizure without a clear cause will probably have another one. And so that could be indicative of a seizure disorder, where they just kind of come on suddenly with no known trigger. But if there is a known cause for your seizures, you are twice as likely to have another. Okay, so if you have seizure disorder, if you have vascular dementia, if you have some other things that cause seizures. Okay. And also, seizures are not contagious. Okay, so if you are around somebody who has a seizure, you will not jump from them to you. You will not catch seizure. It's not contagious. Okay. So there are many different types of seizures. Hold on, my thing's all skewed here. There we go. Okay, so there are different types of seizures and different types of epileptic seizures. And the type of epileptic seizure that, well, we're going to talk about children mainly in this presentation, but this is pretty prevalent whether you're a child or an adult. But the type of seizure that a child has depends on what area of the brain is affected by the seizure, right? What part of the brain is that electrical surge just surging, right? And there are two types of seizures, or two main types of seizures. Focal seizures and generalized seizures. So focal seizures will start in one side of the brain, and generalized seizures will affect both sides of the brain. And generally, adults and children will have the same type of seizures, but some are more common in childhood. So, for example, absence seizures, and they can look like daydreaming or not paying attention, and they're often very, very brief, so you might not even know they're happening. So different types of seizures have some similar symptoms. So that could be jerking movements in the body, repetitive movements, unusual sensations like a strange taste in your mouth or a strange smell, or a rising feeling in the stomach. And some types of seizures, the child may be aware that it's happening, and in other types, they are unconscious and have no memory of the seizure afterward. Okay. And some children may have seizures when they're sleeping, and this is sometimes called asleep or nocturnal seizures. And those during sleep can affect the way your loved one sleeps, obviously, right? It's going to affect their pattern or sleep patterns, and it can leave your child feeling very tired and even confused the next day. So I'm going to go briefly over some of these seizure types, and I'll go ahead and apologize in advance if I get tongue-tied, because for some reason saying the word seizure over and over again makes my tongue revolt. So we'll see what happens. So the first one is the generalized onset or tonic-clonic, also known as grand mal seizures. And that's going to be convulsions, rigid movements, jerking. This is typically going to last between 1 to 3 minutes, and usually the person is very confused afterward. And this, I think, is the one that's most commonly thought of when we think of seizure, right? We think of a very dramatic, spastic, rigid muscle kind of convulsion when we think of seizures, but those aren't the only time you can get. Next one is the absence or petit mal seizure. And that's going to look like a blank stare, and that can really last only just a few seconds. Sometimes the person is blinking or chewing, or like chewing motions while they're having the seizure. Next one is impaired awareness or complex partial seizures. And so this is going to look like staring or dazed facial expressions, right? There's kind of like, staring off into space, daydreaming, and they're not aware of what's going on, and they might not remember that they had one. They may perform repetitive random movements and might not be able to talk normally. And this will last typically between 1 or 2 minutes. And again, this will be followed by confusion. Next one, simple partial or an aware seizure. And so this can involve jerking in a few different parts of your body, one or more parts of the body, or sensory and perception changes. And it may not be obvious to onlookers, to people around, that they're even having the seizure. But the person having the seizure is usually pretty aware during that seizure and aware of what's going on. Next one is atonic or drop attacks. So this is where you have a sudden collapse and you recover within a few minutes. Okay, so there might not be those that spastic movement or those convulsions. It's just going to be a collapse, right? Myoclonic is the next one, and this is sudden, brief, massive jerks involving all parts of the body. Okay, so this one is going to be a bit more extreme to the onlooker. Next, tonic. So this is a sudden stiffening or tensing in the body, arms or legs. The person may fall, but it's only going to last about 20 seconds. Okay. And then finally is epileptic spasm, or also infantile spasms. And so this is just going to be 1 to 3 seconds, and it's going to include arm, leg, and head like movements. The head's going to be kind of pulling into or extending from the body, excuse me, so it'll be kind of like a contraction or an expansion. And this will happen often in clusters. And so every 5 to 10 seconds, for about 5 to 10 minutes, they're going to have these spasms. Okay. So you can imagine this to be incredibly exhausting, especially for a younger person to experience something like that. So now we're just going to define epilepsy. Now that we kind of have a good grasp of what seizures are, we need to know, what is epilepsy. Okay, so epilepsy is a neurological disease, which means it's something that affects the brain. Okay, that's where it's housed. So a person who has epilepsy is at higher risk for having multiple reoccurrent seizures, right? And sometimes people use the word seizure disorder to describe epilepsy. Okay, so if you hear someone say that, that's probably what they're talking about. But a diagnosis of epilepsy does not define the cause or the outlook. Okay, so there's different types of epilepsy. So just saying you have it doesn't necessarily give a linear, clear-cut definition of what that is and how you experience that. Okay, so epilepsy is a spectrum disorder. Okay, so that means there's many different types of seizures, many different types of epilepsy syndromes, and many different ways that a person can experience epilepsy. Okay, so the impact will vary depending on how often they're having them, how severe they are, how it's affecting the brain, like which side of the brain. Is it one or the other? Is it both? What's causing the epilepsy? We'll go into some causes later, or the next slide. And how are you responding to treatment, right? Are you experiencing relief with medication, or is it making it worse? Okay. And then also if there are any underlying brain abnormalities that are present, because not all seizure causes or epilepsy, sorry, not all kinds of epilepsy are caused by the same thing. Okay. So what causes epilepsy? So there's many ways that you can get epilepsy, or epilepsy can develop in the brain. We'll just go through these briefly. So the first one is head injury. Okay, so previous falls, concussions, injuries, just any injury generally to your head, that can cause epilepsy. So of course, if you're going to be riding a bike or skiing or riding a horse or a motorcycle or playing football or anything like that, you want to make sure that you're protecting your head against injury, right? Use your best judgment in that. Okay. And this can really prevent an epilepsy diagnosis. So we want to take it very seriously. You may have contacted a brain infection, right? Like meningitis, that can inflame the brain and the spinal cord, and that can increase your risk for developing epilepsy. Next, stroke or vascular diseases, right? So if you've got something going on with the heart, we all know that heart health equals brain health, okay? So if your heart's affected, it can definitely impact your brain. So blood vessel diseases, strokes, that can cause brain damage, and damage to any area of the brain can trigger seizures and eventually epilepsy, okay? So the best way to prevent epilepsy caused by vascular disease is to care for your heart and your blood vessels, right? Healthy diet, regular exercise, drink your water, right? Avoid tobacco and excessive alcohol use. And I think that's a great string of advice, regardless if you're concerned for epilepsy or not, because that core nutritional and physical health can really protect you against a lot of different things that can develop as you get older. Next, dementia. So people who are experiencing a decline in mental function through or because of dementia can develop epilepsy. Okay, but of course this is most common in older adults. We don't see a lot of young people who have a dementia diagnosis. Next, it could just be your genetics, right? If your close family member has epilepsy, you're more likely to develop it as well, right? So children who have parents with epilepsy, they have a 5% risk of developing the disease themselves. And you might think 5% is not that big of a deal, but it is if you are in that 5%, right? Some children develop epilepsy because their brain was injured in some kind of way. So that could be, again, severe head injury. Maybe there's some birth difficulties, right? During delivery, maybe something happened there to cause some brain injury. Or they, again, contacted some kind of infection. And that can change the structure of the brain. And this is also often called, or sometimes called, symptomatic epilepsy. Okay, so it's not inherently in the way the brain was formed, it is due to some kind of injury that happened afterward. And some people believe, or sorry, some researchers believe, which I'm sure they're people too, but some researchers believe that the chance of developing epilepsy is probably always going to be genetic to some extent. And so anyone who starts having seizures has always had some level of a genetic tendency to do so. This level can range from high to low and anywhere in between. So it's not a guarantee, but you will have more of a predisposition to developing epilepsy um, due to genetic factors. Um, let's see here. Even if a seizure starts after a brain injury or other structural changes, it could be due to both, right? The change in the structure and the genetics, right? So that combination can really increase your chances of developing epilepsy. And that makes sense if you consider that many people might have had a phase, might have had a similar brain injury, but not all people develop epilepsy afterward, right? So we say we both, bonked our head when we were younger, but Johnny didn't get epilepsy, but Jane did, right? Because Jane has a genetic history of it and Johnny doesn't, okay? And epilepsy can begin at any age, but more people are diagnosed in two distinct phases in life, which is early childhood or after the age of 55, okay? So who has epilepsy? In the United States, 3.4 million people have epilepsy, and over 150,000 new cases are diagnosed each year. So 1 in 26 people will develop epilepsy at some point in their life, which I thought was fascinating because I didn't realize it was that common until I created this presentation, but it is fairly common. And epilepsy does not discriminate, right? Like most disorders do not. So it affects children, adults, all genders, all people of all races, religions, ethnic backgrounds, social classes, okay? It knows no discrimination there. And while epilepsy is most often diagnosed either in childhood or after the age of 65, it can occur at any age, okay? So we diagnose epilepsy, well, we, not including me, but professionals, professionals will diagnose it. You got to give them a good description of the event that happened, right? So if you have a seizure or your loved one has a seizure, make sure you're paying attention and give your doctor that good description so that they can determine if it's an epilepsy situation or if it was just a one-off seizure due to external factors or internal factors. So if you can video record it, that could be really helpful because it can help them determine if it was a seizure and what kind of seizure it was. Of course, medical history is always important when you're talking with your doctor, physical and neurological exams. They may do blood work and some other tests that can be important. And that just helps diagnose epilepsy and possibly look for other causes, right? Because you could have a seizure and it's not epilepsy, right? An EEG is one of the most important tests. So that is where we're going to scan the brain and we're going to look for electrical activity because remember, seizures is where kind of like a short circuit happens in electricity in your brain. And so doing a scan to map that behavior, map that activity is going to be really, really key in diagnosing and also helps to decide what kind of epilepsy, if there is one, because it'll tell you which side of the brain is affected, right? And then, of course, CT or MRI scans can be helpful just to look at the brain structure. And then other scans like a PET scan or PET scan, they may be done to measure the function of the brain if seizures fail to respond to initial treatment. And we'll get into treatment in the next slide. Of course, they're probably not going to do all of these at once, right? But this could be ways that they would go ahead and kind of dig into it and see, if there's epilepsy and what caused it and what kind. So how do we treat epilepsy? So there are medications out there, okay? They're called anti-seizure medications, and there are more than 30 of them currently approved to treat epilepsy. And what's really interesting is epilepsy is one of the few disorders that I'm aware of that you can control it usually within the first or second option of medicine that you try. Sometimes people are just trying medication after medication after medication for other disorders, and their body just rejects all of them. So at least with epilepsy, you have a good chance of finding what works for you right away. So about 6 in 10 people may control their seizures with the first or second medicine that they try. But of course, regardless of the numbers, how often you have a seizure, if you don't get control of the seizures in the first year or after the first 2 or 3 medications, then you should probably go and see a specialist. So what are some options beyond medication? Well, there are some that are possible. Surgery is one. So there are some kind of surgeries that can be used for people who don't respond to medication. And that's just the way your body works, right? Doesn't mean there's anything wrong. It just is what it is, right? So if you have a seizure focus, surgery may be recommended when a seizure focus can be found and removed without hurting vital functions like speech or movement. So if they give you those scans and they find out, hey, this is where epilepsy lives, or this is where the seizures live, and they can remove that part or address that part without hurting other functions, then that's an option too. There are devices that can be used. So if you have seizures that are incredibly difficult to control, especially, if you have a seizure disorder and it prevents you from being able to drive or being able to work full time, that's definitely going to cause a lot of problems for you in your adult life. So there's a device, it's a very small device that can be implanted, and that delivers an electrical signal to change what the nerve or the brain does. Okay, so there's different types of devices and they work differently. Like we said, this is a spectrum disorder, so it's not a one size fits all. But there are devices that can be used to kind of counteract or reset those kind of erratic electrical impulses. And then, of course, dietary therapies, right? Food is a great resource when it comes to bettering our health and our well-being. So there are therapies that can control seizures in both children and adults when medicines alone don't work, okay? So 4 major dietary therapies. There's the ketogenic diet. There's medium chain triglyceride diet, or the NCT diet. Modified Atkins diet, right? We all know Atkins is that carb-free diet, but we also know that your brain does need carbohydrates, so a modified version might work for you. And then there's the low glycemic index treatment, the LGIT, okay? So all of these are low in carbohydrates, like pasta, sugar, and bread, but they are high in good fats, right? So butter, oils, avocados, bacon. I don't know, that's not really a good fat, but it tastes good, right? I would assume that your doctor would ask you to consume it sparingly, right? I don't want anyone to think that you can just eat bacon and cure yourself of epilepsy. It's probably not going to be the case. All right, now we're going to go into some ways to address a seizure if it happens when you're around, okay? It can be very overwhelming when a family receives a diagnosis of epilepsy, especially if you're not sure what to do and if you're always kind of on your toes, on the lookout for that seizure to happen. It can be very, very stressful. But not everybody with epilepsy requires a lot of help, but there are some people who require round-the-clock care, right? And if you're on this Zoom because you are caring for someone with epilepsy, chances are you probably have that one side of the spectrum where it's more intense than the other, right? So if you're providing care for a loved one who has epilepsy and you don't know where to begin, or you want to share this information with other people, I'm going to give you 7 tips to get started. So the first one, learn first aid protocol. We're going to go into some myths in the next slide, but understanding what to do when a seizure happens, that is crucial, right? You want to make sure that the person having the seizure is safe, and you want to know what to do. You can act quickly, right? You don't want them to hurt themselves. You don't want them to fall. You don't want them to, if they're moving their arms around, they could hit it on something and hurt themselves. And in most cases, it's very simple first aid and you don't have to call an ambulance. So when someone has a seizure, you want to time it, okay? How long did it last? That will determine on whether you need to call an ambulance or not, okay? Of course, cushion their head, right? We want to protect them. Head injuries are common during seizures, especially when there's hard floors or objects that can cause harm. If you have someone who just has that sudden collapse, that could be big trouble, right? Roll the person into a recovery position. Okay, so this is to prevent choking. Roll them onto their side, and if they have something in their mouth or after they stop moving, okay? Um, we want to stay with them until the seizure stops. The person may be confused or very disoriented afterwards, and so you want to help them remain calm and safe, okay? So you don't have to call 911 for every seizure, but what if you do need to call 911? What does that look like? So if your seizure lasts for more than 5 minutes, call an ambulance, okay? If they're having a hard time breathing, call an ambulance. If they are seizing in water, we want to call an ambulance, right? Because they could breathe some of that water in and we might not even realize, and that can cause problems. And of course, if they have any injury during the seizure, like if they fell and they did wonk their head really bad, right? You want to call an ambulance, right? But again, you don't have to do it for every seizure, but those are some signs that there may be reason to call 911. So let's get into some of these myths before I move on to the next um, suggestion here. There's a lot of myths about first aid protocol with epilepsy, and it's good for us to debunk those, right? First one, people can swallow their tongue during a seizure. I know when I was younger, growing up, that was, like canon, right? That was the first thing that they told you. But it is impossible for someone to swallow their own tongue, whether they're having a seizure or not. Okay. Next, when someone's having a seizure, put something in their mouth. Well, you should never force an object into someone's mouth during a seizure. That's bad news. You can cause injury to the person or even yourself, right? They can bite your hand or they could swallow whatever you try to put in their mouth, right? We don't want that to happen. And the third one is you should restrain someone who is having a seizure. So we don't want to restrain anybody having a seizure, but we should take precautions to make sure they're in a safe place, right? Like move furniture out of the way, moving sharp objects, place something soft under their head, right? But we don't want to like physically hold them to prevent them from having a seizure, okay? That can cause problems. All right, now that we've debunked those myths, let's go ahead and move into the next tip. Number 2, educate your friends and family, right? Like I said before, share this with them or get some resources of your own and share them or just have a conversation, right? It can be very scary if you don't understand the disorder, right? And so if you don't understand it, you don't have awareness, if you're uneducated about epilepsy, that can cause you a lot of anxiety or make you very afraid to be around somebody who has epilepsy, right? Especially if you don't know what to do when a seizure can happen, you might not want to, be in a situation where you mess up really bad, right? But if we teach our loved ones basic first aid, we can help our family and close friends feel confident in the event that a seizure happens and they're the ones in charge, right? They're keeping an eye on your loved one for you. And of course, being an advocate for your loved one, right? That's one of the most helpful things that you can do. It'll help them and the people that are around them feel more at ease and prepared to better handle a seizure, okay? Number 3, track the seizures and the medication, right? Keeping detailed records of both of those can be really important when you are involving healthcare providers in management of the care, right? So it can help you say, hey, we tried this medication and I noticed an increase, right, in seizures, right? You want to make sure that they know that so they can try something new. So what should be documented? What happened right before the seizure, right? That can help your doctor determine what the triggers are so that they can be managed in the future, right? Kind of knowing what causes them or what triggers them is a really simple and useful tool. Next, the date and the time the seizure happened, how long it lasted, how did your loved one behave afterward? Were they disoriented? Do they remember the seizure? Do they not remember the seizure? Are they tired? And then, of course, all the medications that they're on, the dosage of each one, and what time they take those medications, right? Making sure that you're taking your medication in the right dose and the right time, that's crucial in controlling your seizures. And it gives the doctors and the person that you're caring for an accurate picture, right? How well are these medications working? Are they working? Do you need to just scrap them completely and try something new, right? This way you can be proactive in adjusting medications and trying alternate options. So it's never just going to be a one size fits all, right? You want to make sure you're keeping an eye on that. Number 4, think safety, right? As we know, seizures are often unpredictable. So we want to prepare safe spaces in the home to reduce injury, okay? So a few ways that you can increase the safety in your home: install padding on sharp corners, right? Most of us who have had children in the past, especially little ones, we baby proofed our house because our kids could just randomly run into something and fall over and hurt themselves, right? So there's padding that you can put on, table corners and things like that. Carpet floors or area rugs to soften a fall, right? Of course, I'm not saying that you have to go and like completely renovate your house and put, bubble wrap on everything. But if you are caring for someone, or if you yourself have a seizure disorder and you're prone to collapse and you're prone to fall, it might be a good idea to get some kind of padding or flooring, to where it's not just hitting against hardwood, right? Make sure your fireplaces have screens, so that way if somebody were to kind of tip over, they weren't falling, head first into the flames. That screen can provide a little precaution or a little protection for them. There are some heaters, space heaters. People use those a lot, and there's a lot of them now that are newer that have a safety feature. So if they're tipped over, they shut off, right? So if you have a loved one who has a seizure and they knock it over, you don't want that thing just sitting there on the ground burning up, a hole in your carpet, right? Make sure that all smoke alarms and carbon monoxide detectors are working. Up-to-date fire extinguishers are handy. Hide a spare key outside the home in case you or someone else needs to get inside quickly, right? So if you have somebody who maybe is by themselves, they have a seizure, the door is locked, you can't get in, know where the spare is, okay? And then, of course, when out and about, always be aware of your surroundings and take note of any potentially dangerous situations. Number 5, develop a seizure management plan. Okay, so this is a great tool to have on hand to let people know who aren't around you that often, who maybe are, going to come in and babysit or going to provide respite, right? Make sure you have a plan for them in place, so that way, if and when a seizure occurs, they're not scrambling and they're not calling 911 unnecessarily, right? So try to include this information: the type of seizures your loved one has, right? What have they been diagnosed with? All their triggers, right? We know that if Johnny watches, this specific program on TV, it's got a lot of flashing lights, he's probably going to end up seizing, right? Of course, how do you care for them, right? Just say, hey, you just make sure they don't hit their head, make sure they've got something, soft protecting them, make sure, they're not in a space where they're going to like injure themselves, right? And then, of course, signs that the situation is an emergency and steps to take, right? So include that. Hey, if it lasts longer than 5 minutes, call an ambulance. If they're seizing in water, call an ambulance, right? And just make sure that anyone that's going to be around your loved one, they're aware of this plan, and they know what their role is, right? So for instance, family members, friends, secondary caregivers, healthcare providers, right? They all may be part of this plan, understanding this plan. Even maybe they're teachers at school, right? Because maybe not every teacher has the training and understanding of what epilepsy is. I'm sure a lot of them do, but there may be some who don't, and they don't know about your specific child, right? Make sure that the person you're caring for always has a copy of this plan, just in case you're not there. And a copy of their seizure management plan should also be provided, again, to their school or workplace, right? At least once a year, practice an emergency drill, right? I know growing up, we always did the fire drills in the house and the fire drills at the school, right? Just so we can get that embedded in our brain, that routine becomes second nature. So practice it with your loved one, right? What steps are you going to take if there's an emergency, right? Coordinate with the household and make it as close to reality as you can, okay? And little ones seem to love drills for some reason, so they'll probably be on board. All right, and number 6, encourage participation, right? Just because your loved one has epilepsy doesn't mean that they can't participate in things like sports, right, or other activities. And it's really important to maintain physical, mental, and emotional health. And a lot of things like that, like activities and being out and active with friends, and physically active is healthy, right? Recreational activities, of course, should be cleared by their doctor or their healthcare professional, because they're going to be familiar with their medical records and seizure triggers and stuff. And they might say, well, hey, Johnny's got this form of epilepsy. It's incredibly severe. Maybe, this activity might not be for him, or we need to come up with some clever modifications, right? But we don't want to discourage participation. Just because you have an epilepsy diagnosis doesn't mean you can't live an active, healthy, a typical lifestyle, okay? You just have to be more aware. And so, of course, depending on the severity of the seizures, there may be some activities like contact sports that are off limits, or activities that a buddy will need to be present, like swimming, right? We don't want to just toss somebody who has a seizure disorder in the water and not have people aware of that so that they can keep an eye and make sure that everybody's safe and sound, right? And the last tip I have for you, take care of yourself, right? So of course, we know you love your loved one, right? You want to take care of them, but we also want to make sure you're taking care of yourself as well. Taking care of you is taking care of them. I've said it a million times and I'll say it a million more. I can't count that high, but you know what I'm saying. If you're constantly worried or stressed about unpredictable seizures, you're going to be exhausted, right? And that's normal. But we also want to know that it's normal to feel this way, but we also have to counteract it with some self-care, right? We can't just be caught up in a worried knot all the time. That's not good for you and it's not good for your loved one. Okay. So take that time for yourself. Make sure you're getting enough sleep. Make sure you're eating food that fuels your body and your brain, right? We don't just want to fill our bellies. We want to give our bodies, sound building blocks, sound resources to build ourselves back up, right? Take time to relax and recharge regularly. Okay. A lot of times we skip that. We think, I don't have time to rest. I would argue you don't have time not to. Okay. Most importantly, ask for help when you need it. Okay. Hopefully, this presentation has given you at least a good baseline resources to where you can share it with people. So if you say like, hey, can you keep an eye on Jane while I go to a movie with, with my husband or with my wife or whatever, they might not be comfortable because they don't know how to handle a seizure if it were to come up. But if you give them this information, they might be more likely to be like, oh, it's not as scary as I thought it was. Definitely, I'll sit and watch your kiddo while you go out and have a good night, right? So it never hurts to ask. So that's my info for you. And I'll briefly put up my references here. And if you want a copy of my references, please let me know. And I'm more than happy to email that to you so that you can do your own research. I always advocate for that because I can only give you so much in a presentation and I don't know your personal situation. So it's always good to go out and do your own research. And this could be a great starting off point if you haven't already done so yourself. All right, so let me stop my share.